We'll be talking about how to manage hypertension. In today's live broadcast, we will be discussing how do we manage high blood pressure. Okay, and we're also going to discuss hypertension, connection to stress, and how to cope. We're also going to discuss hypertension fact that you must know. Okay, so without wasting much time, let's dive in. Okay. Okay, so hypertension is a medical term for high blood pressure. Okay, it means the force of blood pushing against the wall of the artery is consistently too high, which makes the heart and blood vessel work harder than they should. In a simple term, let's take this as an example. In a layman language, high blood pressure is the force of blood pushing against your blood vessel as your heart pumps. Okay? Think of it like this. Think of it like water pump in a hose. Too low means not enough flow. Too high, too much force, which can stress the hose, which is your blood vessel, Okay? So hypertension, like we said, is the medical term for high blood pressure. It means the force of blood pushing against the wall of the artery is consistently too high, which makes the heart and blood vessels work harder than they should. Okay? So blood pressure, like we said, is written in two numbers. For example, 120 over 180 mmHg. Okay? The top number is called the systolic. The top number, that is pressure when the heart beats or when the heart pump. Then the second number, which is the bottom number, is the pressure when the heart rests or when the heart relaxes. Hypertension usually is diagnosed when blood pressure stays at or above 130 over 80. Okay? Over time, for adults, ranges can differ for kids and teens. Remember we said earlier that in year 101, we cannot overemphasize the importance of blood pressure monitoring machine. I will say that if you are diagnosed with high blood pressure, that you need to get a blood pressure machine. That will be your first line of management. Okay, and that you should buy a notebook and record every reading when you check your blood pressure. And we also strongly encourage that you check your blood pressure first thing in the morning when you wake up and before you go into bed, and keep all this record so that when you go to your primary care physician, you will be able to show him the record for proper management of your blood pressure. Okay, I will say that you can actually get the blood pressure monitoring machine or the blood pressure machine from your local grocery stores like Walmart, Publix, Kroger, Walgreens, CVS, and also pharmaceutical stores close by you or in your neighborhood. You can actually get online too. It doesn't need prescription. Okay, so without wasting much time, let us talk about the causes of hypertension. There are two main types based on the causes of hypertension. Okay, the first one will be primary hypertension. Primary hypertension, which also known as essential hypertension, this is the most common type and it is developed gradually over time. There is no single clear cause, but it's linked to a combination of factors such as family history, which is genetic, unhealthy diet, especially too much salty food. So we are saying that primary hypertension, which is also the most common type of hypertension, is developed gradually over time. And we are saying that there is no single clear cause, but is linked to a combination of factors such as family history. Your grandfather has hypertension, great-grandparents have it, your parents have it, and now you are at risk for it because it's a genetic factor. Okay? It run across the family history or family lineage. So that will be family history genetic. They also say that unhealthy diet, especially too much salt, can also cause primary hypertension. Lack of physical activity can also be a contributing factor to the causes of primary hypertension. Being overweight, obesity, okay, obesity can also cause hypertension. Okay, long-term stress. If you are stressed for too long, it can also it's also a contributing factor to hypertension. Okay, long-term stress is a contributing factor to hypertension. Poor sleep. You sleep less than 7 to 9 hours of sleep. Poor sleep can also be a contributing factor to hypertension. So another type of hypertension is secondary hypertension. Secondary hypertension, this type is caused by an underlying medical condition or factor. Okay, and it can appear suddenly. Possible causes include kidney disease, heart problem, hormonal disorder like thyroid or adrenal issue. Certain medication, for example, some steroid or decongester, can be a contributing factor to secondary hypertension. Congenital from a blood vessel problem from birth. This is why most pregnant women are being prescribed vitamin B6 to avoid a congenital blood vessel problem. Okay, why hypertension matters? Why does it matter? Now we are saying that if untreated over time, high blood pressure can increase the risk of heart disease. If untreated over time, high blood pressure can increase the risk of heart disease. If untreated over time, high blood pressure can increase the risk of stroke. If untreated over time, high blood pressure can increase the risk of kidney damage. So you see why hypertension matters. If untreated over time, high blood pressure can increase the risk of vision problem. So you see why it is very, very important for us to to pay close attention to hypertension and for us to properly manage it. Hypertension, consistently high blood pressure. It can develop slowly due to lifestyle and genetic, like we have said before, or because by another medical condition, often has no obvious symptom, which is why it is sometimes called silent killer. Okay, if you still dwelling on hypertension, we are saying that what are the symptoms of high blood pressure? Let's look at the system of high blood pressure. Most times, high blood pressure has no symptoms. This is why it is sometimes called the silent condition or the silent killer. Okay, most people sometimes don't have the symptoms of hypertension. They look very healthy. They are very agile and active with their daily activity. But little do they know that they've been living with high blood pressure all their life. Okay. But if it gets high, remember what we said most of the time high blood pressure has no symptoms. And this is why it is called the high killer, the silent killer. Okay? We are saying that, but if it gets very high, some people might notice headache. So some people might notice dizziness. Some might notice blurry vision. Some might notice nosebleed. So some people may be feeling tired or shortness of breath. So if you're having a severe headache that wouldn't go away with over-the-counter medications such as Tylenol or ibuprofen or Advil, go and check your blood pressure immediately, and also try to hydrate yourself properly. If you get up and feel dizzy, or you just wake up and feel dizzy, dizziness might be a sign of hypertension. So you may want to get your blood pressure checked out immediately. Blurry vision, everything look fog, you can't see clearly, or everything look double. This might be hypertension symptoms. So you may want to get in touch with your primary care physician and get a blood pressure check immediately. We also said that if you have a nose bleeding without a physical contact, you want to check your blood pressure. It might be high. This might also be a symptom of high blood pressure. Feeling tired or shortness of breath. If you are tired, you have shortness of breath, often get fatigue. This might be a sign of hypertension. You want to get yourself checked out, okay? High blood pressure is measured. High blood pressure usually checked with a cuff around your upper arm. Okay, so we're talking about how do we measure high blood pressure. I would say the high blood pressure usually checked with a cuff, CUFF, around your upper arm. Here's what happened. The cuff is tightened to briefly stop blood flow. Then it's slowly losing. A machine or doctor listening measure high blood pressure flow back. You get two numbers. We've said it before that the top number is systolic, which measures the heart pump or heartbeat. And we say that the second one will be the bottom number, which is diastolic, when the heart relaxes. It's quick, safe, and does not hurt. Just feels slow for a few seconds. Okay, so see on high blood pressure. See on high blood pressure. Okay, we said that high blood pressure have no actual symptom. Okay, had no actual symptom. Okay, that's why it is known as a silent killer. Okay, we are saying that if by any chance you feel dizzy, you have headache, you feel fatigue, this might be a symptom of high blood pressure, and we encourage you to check your high blood pressure, to check your pressure immediately. Okay, so how to prevent high blood pressure? Remember, in Gateway 101, we place so much emphasis on prevention, because we strongly believe that prevention is better than the cure. So we place so much emphasis on prevention. And one of the major prevention and one of the methods to prevent blood pressure is to healthy habit make a big difference. Healthy habit make a big difference. We say that eat balanced food, fruit, veggies, whole grain. Okay, to make a big difference. Don't overdo salty snacks. Salty snacks are very high in salt, and soda content is always high. So avoid overdo of salty snacks. Okay, stay active. Sport. Do at least do 30 minutes of sport daily, and do walking, walk around the neighborhood, walk around your house. Be active, be agile. Or dancing, cycling, swimming, light exercise. Engage in a very light, non combat kind of exercise. Okay? This will go a long way to help. We also said that stay active. We also said that get enough sleep. Because if you don't sleep well, you become stressed, you stretch out. And when you stretch out, your pressure will be temporarily right due to hormonal release. Okay? Avoid smoking or vaping. Smoking cigarette will definitely raise your high blood pressure, will rise up your pressure. So stay away from vaping, stay away from smoking. It is not good for your health. Okay. Avoid smoking. It's not good for your health. This habit helps your heart stay strong as you grow. Okay. Quick recap. Blood pressure, high blood push in your body. High blood pressure often has no warning sign. That's why it is known as a killer, silent killer. It measures with an arm curve. Okay. I would say that healthy daily habit help keep it in a good range. Okay. We also say that high blood pressure also says that high blood pressure can be managed. Okay. High blood pressure can be managed. So How do we manage high blood pressure? Is regular medical checkup. Okay, regular medical checkup is a key. It's number one key factor. That's why we're saying that you cannot overemphasize the importance of checking your blood pressure. I would strongly encourage you to check your blood pressure at least 2 times a day. When you wake up, first thing when you wake up in the morning and before going to bed, and keep your proper record of your blood pressure reading. We also said that you can give this to the medical provider to better help manage your blood pressure. Okay, so follow up with your primary healthcare provider is key. Okay, then managing high blood pressure, hypertension usually involve a mixture of healthy lifestyle changes and, when needed, medication. The goal is to keep your blood pressure in a safe range and reduce the risk of heart disease, stroke, and kidney problem. Okay, so healthy lifestyle change. I would say that the first line of management is to get a blood pressure machine. Okay, get a blood pressure machine and check your blood pressure regularly. That is the first line of management. Yeah. So, second line of management would be healthy lifestyle. Eat a heart-healthy diet. Follow the DASH diet, also known as dietary approaches to stop hypertension. The DASH diet. The acronym for that is DASH, DASH diet. Dietary approaches to stop hypertension. Eat more fruit and veggies. Okay, whole grain. Lean protein such as fish, beans, skinless poultry. Okay. Reduce salt. Aim for less than 1,500 to 2,300 milligrams of your daily salt intake. Fried food and processed food. Sugary drinks should be greatly reduced. Remember, we're talking about management of hypertension. Okay, managing high blood pressure. Reduce salt intake. We said that before, we're emphasizing it again. Avoid packaged and fast food. Okay, packaged foods are preserved with a lot of sodium, a lot of sea salt. Okay, fried food and processed food contain a lot of fat. Okay, unhealthy fat. Avoid a sugary drink. Okay, reduce salt intake. Avoid packaged food. I said that before. I also said that use herbs and spices instead of salt. Use herbs and spices instead of salt. So if you have been diagnosed with high blood pressure, you should pay attention to fried food, packaged food. Okay, make sure you read their labels. If there's no label, don't buy it. You can let the provider and let the store manager know. Okay. We also said that you should read every processed food label you buy. Read the contents of the label. Okay, if the sodium intake is very high, leave it alone. Don't worry about it. Just leave it alone. maintain a healthy weight, and we will say that losing 5 to 10% of your body weight can significantly lower your blood pressure. Obesity is a contributing factor to high blood pressure. Okay, so just losing 5 to 10% of your body weight can significantly lower your blood pressure. Exercise regularly, at least 30 minutes of moderate exercise, walking, cycling, swimming most days of the week. Aim for 150 minutes per week of regular exercise. Avoid smoking and limit alcohol intake. In this broadcast, we said you should totally avoid smoking and sodium intake. Okay, so it's better you be at the extreme than be at the bottom line. So if you have diabetes or high blood pressure, we strongly encourage you to avoid quit smoking completely, stop smoking and quit drinking alcohol. They not like small alcohol. It all add up. Okay? Quit smoking completely, we say that. Avoid alcohol completely, we say that also. Managing stress, and we say that practice relaxation techniques, deep breathing, meditation or prayers, yoga, exercise. Get enough sleep, 9 to 7 hours per night. Yoga exercise is very, very rich for stress management. Okay, so those are, you can practice that to help you reduce stress. Okay, and monitor your blood pressure. Okay. You have to monitor your blood pressure closely. That's why we said that you go and get the blood pressure machine, because you don't need to go to the doctor office to use that. You can do that at home. So check your blood pressure regularly at home. Keep a record to share with your healthcare provider. We'll say this again, I will repeat it again. Okay? Okay? So, take medication if prescribed. If lifestyle changes are not enough, doctor may prescribe medication for you. So, if your medication, such as your Warapid, diuretic, AAC inhibitor, calcium channel blocker, beta blocker, any of these medications may be prescribed. So, always take your medication exactly as prescribed and don't stop without consulting your doctor. If you're on high blood pressure medication, make sure you stick to the prescription. Okay? Regular medical checkup cannot be overemphasized. Follow up with your healthcare provider. Manage related conditions like diabetes and high cholesterol. Okay? When to seek help. We strongly encourage you to seek help immediately if your blood pressure is reading anything between 180 over 120. This is a stroke about to occur. Okay? If you seek help immediately, if you have a blood pressure reading 180 over 120, it's not healthy at all. Severe headache, chest pain, shortness of breath, or vision problem. You have a persistent headache, chest pain, hyperventilating, or hypoventilating. you should seek a medical help immediately. Okay? So, what are some of the basic facts about hypertension that you need to know? Here are common hypertension facts and the real fact everyone should know. Hypertension always has a symptom. No, that is not true. The fact is, high blood pressure is often called the silent killer because most people feel normal. Many don't know they have it until complications occur. Regular BP checks are essential. Okay? Only salt causes hypertension. No, that is not true. The fact is, excess salt contributes, but hypertension also depends on genetic, obesity, stress, physical inactivity, alcohol and smoking, poor diet overall. Salt reduction help, but is not the only factor. Okay? High blood pressure is only for other people. False. That's not true. The fact is, high blood pressure hypertension can affect young adults, teens, and even children, especially with obesity, stress, or family history. Okay? Once on medication, you can stop when blood pressure improves. That is not true. The fact is, blood pressure usually improve because of the medication. So stopping it without medical advice can cause BP to rise suddenly and dangerously. Okay, hypertension is not serious. If you feel fine, you are okay. That is not true. Hypertension is a serious threat. The fact is, untreated hypertension can lead to heart attack, can lead to stroke, can lead to kidney failure, can lead to blindness. Okay? Even without symptoms, damage may already be happening. Exercise alone can cure hypertension. False. Exercise can help significantly, but reduce high blood pressure, but many people still need medication, lifestyle change, or proper control. Okay? Coffee always causes high blood pressure. That is not true. Coffee may cause a temporary rise, but it does not cause chronic hypertension in most people. Sensitivity varies by individual. Okay? If it runs in your family, nothing can be done. That is not true. Fact is, family history increases risk, but eating habit can delay or prevent hypertension. Okay, I will talk about DASH diet, dietary approach, stopping hypertension. We'll talk about DASH diet. We'll talk about weight control, regular exercise, and stress management. Now, natural remedy can replace medication. That is not true. The fact is, some natural approach help. Diet, exercise, weight loss, but they should not replace prescribed medication without a doctor approval. Okay? Normal blood pressure today means you are safe forever. That is not true. The fact is, blood pressure changes over time. Ongoing monitoring is important, especially if risk factors exist. The key takeaway here is high potential high blood pressure is common. It is a silent killer and it is serious, but controllable with proper knowledge, regular monitoring, and consistent care. Okay? So, let's talk about what are the connections between high blood pressure and stress. I will say that stress can raise blood pressure temporarily. When you feel stress, your body releases stress hormones, which speed up the heart and tighten blood vessels. That's the basic fight or flight response. Okay? I will say that when you feel stress, your body releases stress hormone, which speed up the heart and tighten blood vessels. That's the basic fight or flight response, and it causes a short-term pump in blood pressure. Chronic or repeated stress matters. Too long-term stress is not a nightly understood, but it can contribute to factors that worsen blood pressure. That's true. Like poor diet, alcohol overuse, and disrupt sleep. The American Heart Association notes stress linked to this risk factor, and that managing stress is a life skill worth cultivating. Okay? Evidence show stress relates to increased long-term risk. Okay? A meta-analysis of coherent study found people who reacted more strongly to stress were about 21% more likely to develop an increase in high blood pressure over time. So getting stress control is relevant for managing hypertension. Okay? Stress, higher stress hormone level predict future issues. A study summarized by the American Heart Association found adults with higher level of stress hormone were more likely to develop hypertension and cardiovascular events later in life, reinforcing that stress is not just a fleeting discomfort, it can be tied to real long-term health outcome. Practical coping strategies that actually help. Okay, what are some of the practical strategies that help control high blood pressure? These are evidence supported or widely recommended healthy habits that can reduce stress or its impact on blood pressure. 1. Mindfulness or structured stress reduction program is one of the practical coping strategies that we can use. Okay? Why is this useful? Randomized clinical work on mindfulness-based stress reduction show meaningful drop in both systolic and diastolic blood pressure after a 12-week program, along with mental health benefits that points to meditation style approach, not just feeling nice, but actually helping numbers. How to start? Try short daily session, 5 to 10 minutes to begin, with apps or video that guide breathing or focus attention. If possible, look for a local or online structure course or use established MBSR curriculum with a simplified routine can help build a habit. Yoga and similar body practice can help reduce stress. Recent systematic review of yoga for blood pressure control suggests yoga is a promising option for people from pre-hypertension to hypertension. Though more large, high-quality studies are still encouraged, the current evidence is positive enough to consider it as part of lifestyle plan. Okay, so how to start? Begin with gentle session that include breathing. Breathe out for 4 seconds and breathe in for 4 seconds and breathe out for 6 seconds. Stretch, walk around, and mind movement 10 to 15 minutes a few times per week. That will help you reduce stress. Choose beginner or therapeutic classes. Many community center or online platform offer short, accessible routines. Regular physical activity. Why is it useful? Exercise is consistently recommended to fight stress and support blood pressure control. It can help you manage stress in the moment while improving sleep, mood, and overall cardiovascular health. The American Association lists regular exercise along meditation, controlled breathing, and sleep as key habits to fight stress. How to start? Aim for activity you enjoy, like walking, swimming, biking, or light jogging. Jog around the neighborhood. Even 15 to 20 minutes brisk walk can be powerful after a stressful day. Gradually build up frequency. Consistency matters more than intensity at first. Okay, so sleep and basic self-care. Why does it matter? Poor sleep worsens stress response and can directly raise blood pressure through fatigue, poor food choice, or mood. Good sleep lets your body rest, reset, and reduce tension. American Association guidance specify include getting enough sleep as part of stress fighting habit. As a regular bedtime, keep the bedroom cool, dark, and avoid screen or heavy metal right before bed. Avoid heavy meal before bed. If sleep is chronically poor, it's worth discussing with a clinician since sleep problem can feed into stress and blood pressure issue. Social connection and simple relaxation techniques. Why is it? Why it help building supportive relationship and take short break to relax can reduce perceived stress and improve relaxation. The American Association highlight connection, support and relaxation, like quiet sitting or deep breathing as part of building relaxation against stress. How to start? Schedule short call or meet up with friends or family. Practice a quick breathing exercise when you feel overwhelmed. Inhale slowly for a count of 4 to 5 seconds. Hold briefly. Exhale slowly for a count of 5 to 6. Repeat a few times. Okay? How to put it together day by day. Pick up one core habit for the week. Stay 10 minutes of guided mindfulness each morning and add one more small action if you can, like a 15-minute walk after dinner. Notice trigger plan and response. Notice triggers and plan response. If work email spark stress, set a routine to pause and breathe or step aside before checking them rather than letting stress build up on a check. Okay, keep it realistic. The strongest chance is the one you actually do most day. Even most reduction in stress and better habit can add up over time. when to seek medical guidance. If you already have diagnosis of hypertension or suspect you might, consult a qualified healthcare professional about your blood pressure reading, medication if needed, and a safe, tailored plan that includes stress management. If stress, sleep problem, or mood issue feel overwhelmed or persist, a clinician or mental health professional can help, sometimes with counseling or other support that complement lifestyle step above. The bottom line is stress is linked to blood pressure, risk through hormones, lifestyle effect, and long-term pattern. Building small daily habits, mindfulness, yoga, physical activity, better sleep, and social support can reduce stress and support healthier blood pressure. If you need some home remedy, you can follow us on our social media platform. We get to 101. We have some home remedy that will help alleviate your high blood pressure. Okay, there are some home remedy we have that will help alleviate your blood pressure. Okay, until we come your way again, this is Get 101. Thank you for watching and bye for now.